Random sampling, the dilemma of validity. How does one apply research into a greater context? How can I apply my trial into a real world setting? These are all common questions a researcher will have when undertaking a research project. In the following slides, you will learn about the interesting possibilities of sampling. Why should we consider random sampling? Shouldn't research be a controlled systematic setting? The answer lies on variability. The bigger your study is in a real world setting, the greater the number of outliers it will encounter. This population on which your study will apply to in a world setting is called a target population. When considering the target population, one must consider how to have the most impactful sample. To do this, one must create a sample plan. A sample plan usually includes the method of sampling the target population, the size of the sample, and the process of recruiting the sample. All of these points coexist in balance. For example, if the recruitment of subjects for a specific drug is marketed in limited English proficiency areas, the sample will skew towards the characteristics of that population, which might prolong recruitment efforts in order to meet the sample characteristics and size. What are some of the examples of sampling methods? First of all, convenience sampling is commonly used in research because of its availability and resource effectiveness. Convenience sampling uses participants that are easily available. Systematic sampling. Systematic sampling uses the available population and creates a list of subjects called a sampling frame, then randomly selects from the list based on the determined sample interval. Stratified sampling. Stratified sampling is when the sample is divided into trait groups and the sample matching selection is acquired from those groups. On the other hand, there's proportional stratified sample. A proportional stratified sample is when the sample size selected from the groups tries to reflect the target population. If a specific disease has a greater characteristic trait, there will be more recruitment towards that trait. Snowball sample. Snowball sampling uses previously included subjects to recruit the next participant with similar characteristics. Cluster sampling. Cluster sampling only selects a piece of subjects based on the area of availability, not the biological traits. Although many examples exist, these represent an idea of the working frame for research methodology. Sample size. Know your population. Once you have envisioned a sampling method, you have to calculate what's your target sample size. Today, we won't discuss the mathematical calculation of a sample size, but rather the consideration towards knowing the limitations of the number of subjects. The first thing to consider is called sample frame. A sample frame is a list of possible candidates according to the target population and availability. For example, if you're studying the complications of cystic fibrosis in the ICU in a rural community, your sample size will be limited if the prevalence of cystic fibrosis is low in your geographic area, which would, in turn, affect the length and cost of your project. When considering your sample frame, you must consider data saturation. Data saturation is what commonly understood as the background knowledge of your study and the characteristics of your study population. An example of a well-designed sample using data saturation would be a research study on lead toxicity in pediatric populations in Flint, Michigan. In comparison to other areas where the recruitment and exposure would be difficult to justify, the overall aspects of this example would be easily delivered. The second and third considerations of sample size are the inclusion and exclusion criteria. When considering inclusion criteria, you must consider the size of your available population. Can all of these subjects be included without hurting my internal validity? On the other hand, exclusion criteria should decrease confounders without hurting the targeted population generalizability. Data saturation. As we discussed previously, data saturation tries to collect evidence of how your available saturation fares in comparison to your target population. The data should be viewed in a qualitative fashion in order to create high-quality exclusion criteria. Using the previous lead example, one could exclude children that moved to Flint, Michigan in the past year. Data saturation allows you to generalize knowledge before collecting the information. Sample recruitment. Sample recruitment is based on what is available in your area. Understanding the cost and policy limitations are important. The importance of sample recruitment that is feasible is trying to diminish sampling bias by trying to be inclusive of the target population and not recruiting a specific group. The challenge lies in understanding your target population dynamics. If you're doing geriatric recruitment, maybe the use of certain social media streams will limit recruitment of that representative population. Finally, let's speak about how sampling reflects on the clinical side. When considering clinical sampling, one must consider the outcomes and goals of the study. As always, safety should be the main concern. Usually, the important question is how do I increase statistical power without hurting my applications? These questions can be very hard to answer because, in the perfect setting, we would be exposed to a representative large sample that doesn't have a high dropout rate. But that is not the case. In my perspective, one must consider the cost of what we are doing before creating the theory of sample selection. Time is money, as one says. If we want to create impact, sometimes we must sacrifice certain aspects and lean towards convenience to decrease monetary cost and time cost. While some research has lots of previous evidence that allows for random sampling on your available population, others don't. I hope that this talk helps you explore your own research possibilities. Thank you very much for listening.